Is a watery period a sign of pregnancy?
Hey there! Welcome to our video today, where we'll be discussing an interesting question. Is a watery period a sign of pregnancy? Pregnancy can be an exciting and sometimes confusing time, so it's essential to understand the various signs and symptoms. Let's dive in and explore this topic further.
Understanding the menstrual cycle.
To understand whether a watery period could be a sign of pregnancy, we first need to grasp the basics of the menstrual cycle. The menstrual cycle is a monthly hormonal process that prepares a woman's body for pregnancy. It involves the shedding of the uterine lining, which leads to menstruation or the monthly period.
Normal characteristics of a menstrual period.
During a typical menstrual period, it is normal to experience a range of consistencies in the menstrual flow. The consistency can vary from thick and clotted to watery and light. Factors such as hormonal fluctuations, lifestyle changes, stress levels, and underlying health conditions can influence the characteristics of a menstrual period.
Watery period versus implantation bleeding.
Now let's talk about watery periods specifically in relation to pregnancy. It's important to note that a watery period is generally not considered a reliable sign of pregnancy. However, some women may experience a phenomenon called implantation bleeding, which can sometimes be mistaken for a watery period. Implantation bleeding occurs when a fertilized egg attaches itself to the uterine lining, causing slight spotting or light bleeding. This bleeding is typically much lighter and shorter in duration compared to a regular period. It may appear as pink or brownish discharge and can sometimes have a watery consistency.
Other signs of pregnancy.
While a watery period may not be a definitive sign of pregnancy, there are several other common signs to look out for. These can include missed periods, breast tenderness, fatigue, frequent urination, nausea, and heightened sensitivity to smell. If you suspect you might be pregnant, it is advisable to take a home pregnancy test or consult with a healthcare professional for confirmation. To sum up, a watery period is generally not a sign of pregnancy. It is more likely a normal variation in the characteristics of a menstrual period. However, if you experience unusual bleeding, especially when combined with other pregnancy symptoms, it is always best to consult with a healthcare professional to rule out any potential concerns. We hope this video has provided some clarity on the topic. Remember, everyone's body is unique, and if you have any doubts or questions about your menstrual cycle or pregnancy, seeking medical advice is the best course of action. Thanks for watching, and we'll see you in the next video.